So one of the first questions we did was, we have these 6 groups, and what is the likelihood of one of these patients being high cost? And by high cost, we mean, we defined it as being in the top 10% most expensive group in the Medicare population. So within each segment, what proportion of them are high cost? So the under 65 disabled, so the non-elderly disabled, 14.3% were high cost. And then you see that the frail elders are by far the most likely to be high cost out of across the 6 segments. So nearly 1 in 2 frail elders will be a high cost patient in a given year. Then you can see that the major complex chronic is about 11%, and then not very many, the proportion of patients who are high cost in the other 3 groups is very low, ranging from 1% to about 3.7%. The next question is, so how are these high costs distributed across these segments? And what you see, again, not surprisingly, 25% of high cost patients are non-elderly disabled, 39% are frail elders, and then the rest, very smaller proportions across the other groups. So this is just to show that high cost patients tend to be concentrated across 2 of our segments. So the next slide, I want to show mean spending of segments by high cost status. That is, how much money are these patients spending in a given year? So here there's 12 bars, 2 bars per segment. An orange bar is if you're a high cost patient, and then the gold bar is if you're a non-high cost patient. And what you see is that to be a high cost patient, you have to spend a lot of money, over $50,000 per year. But there's a signal, though, to suggest that if you're non-elderly disabled or a frail elder, you spend about $15,000 more than other high-cost patients in the other groups. And then when you compare it to non-high-cost patients, you can see that there's a significant difference between the 2 groups.